indications. So here are the indications. Number one, if the victim is an adult. Okay, remember. Okay. Why? Because you need the defibrillator to come, right? As early as possible. Remember here, right? Look at this. Early defibrillation plus CPR, okay, the chance of survival is 75. Okay, so you need to come, the defibrillator to come immediately. Okay. So remember, okay, if the victim is an adult, you should think of the heart first, okay, because as you know, VF, okay, is the most common cause of sudden cardiac arrest. Okay? VF is an electrical problem of the heart, correct? Right? Okay. So you need an electrical solution, okay, the defibrillation, the defibrillator. Okay? So look at this. The chance of success of reviving the patient is reduced by 7 to 10% each minute a fibrillating heart is not defibrillated. For example, the patient already gone into cardiac arrest, okay? Already 5 minutes, okay? So the patient loses how much? 50% chance of survival already. So you need the machine to come as early as possible. That's why you need to call for ambulance. Okay? If you are alone, okay, what should you do? You are allowed to leave the victim, okay, to call for help, okay, if you're alone. But if you're with somebody, what should you do? You ask the other person to call while you start the CPR. Okay, besides adults, remember, okay, another indication would be children, okay, known to be high risk for cardiac arrhythmias. Next, okay, indication for doing CPR first, okay. So you should do CPR first before you call for help, okay. So number one, what's the number one indication? If the victim is what? Infants and children, okay, remember that, okay. You don't need to call for help, okay. You need to start CPR. Why? Okay, here, everybody read. Okay, so respiratory failure is the most common cause of arrest in infants and children. It's not the heart, okay? It's not VF, okay? But a respiratory problem, okay? Excuse me. Okay, so if you're alone, what should you do? Perform a 2-minute CPR first, okay? Before you call for help. Another indication, okay, submersion injuries or near drowning. What do you mean by that? Submersion. What is submersion? Submersion. When I say submerge, is what? Go under the water. Submerge. Near drowning. So victims who are, for example, children playing in the swimming pool, right? Trauma and drug overdose. Okay. Okay. Look at this list. Okay. The causes of CP arrest in children. Okay. Well, number one, motor vehicular accident. Okay. There. Okay. Number two, okay, FBAO. Everybody read. Okay. So FBAO. In short, what does it mean? The child swallows something, a foreign body, a coin, a ball, a candy, and got stuck in the lungs, the trachea. Choking. Okay, SIDS. Okay, read. Does SIDS mean sudden? What is that condition? Have you heard of SIDS? What is that? Call it. SIDS. Nancy. Any idea? What's that? This is the condition we're in. Sometimes, okay, parents wake up, okay, in the morning, okay, and then the baby is already dead, okay, don't know any reason. Eh? When you look at the baby, okay, everything seems to be normal, but he died. Unknown cause. Okay, we call that condition SIDS. Okay. Okay, what else? Smoke inhalation. Okay. Okay, infection of the throat and respiratory tract. What do you call the infection of the throat? Oh, what is infection of the throat? Pharyngitis, right? Throat is the pharynx, right? So pharyngitis. And infection of your respiratory tract, which we call what? URTI, right? LRTI, upper lower respiratory tract infection. Okay, what else? Poisoning, there. Okay. CHD, genital part defects. Excuse me. Okay. Okay, so CPR, okay, how do we define CPR? It's a combination of rescue breathing and chest compressions, okay, delivered to victims thought to be in cardiac arrest, also known as BLS. Okay. So when you do your CPR, okay, just remember the ABC, okay, the ABC of basic life support. ABC. What should you think of first? Okay, airway, okay, then breathing, and then circulation. So remember each step, okay, you should do assessment. Okay? Assessment before you do something. Okay? For example, okay, I'll ask you a question. If the victim has an airway obstruction, okay, so we should do assessment first. Okay, so what should you assess? What are the symptoms that you should assess? Inability to speak, right? If you have something in the respiratory system, the patient cannot speak. Okay. What else? Cyanosis, right? The fingernails will turn blue. What else? Okay. Collapse. Okay. The patient will collapse because there's obstruction in the airway. Okay, so remember, if there's an airway obstruction, death can occur within 4 to 5 minutes. Okay. That is for airway obstruction. Okay. Another question. Okay. What if the victim have cardiopulmonary arrest? Okay. What should the nurse assess for? That's my question. If the victim have cardiopulmonary arrest, what should you assess for? What symptom? Breathlessness. Okay. Right? What else? Pulselessness. Right? And unconsciousness. Right? Right? Correct? Okay, so patients who had undergone cardiopulmonary arrest, what are the most common symptoms that you will see? So there will be breathlessness, no breath. Okay, so breathlessness. Okay. Pulselessness and unconsciousness. Right? Not conscious anymore. Sometimes okay, you add letter D, right? A, B, C, D. What is D? Defibrillation. Sometimes you add E. What is E? Epinephrine, right? You need to give epinephrine. That is just like nice to know. I will not ask you that in your okay. Let's now go first to adult CPR. Okay, so what should the nurse do? Comment question.